7. Hi, my name is Brianna Neal, and I'm your nurse practitioner for today. Hand hygiene. Okay, can you tell me your name
Sam,
and what month and year this is?
August 2024.
Where are you at?
I'm at home
And why are you here?
for a checkup.
Okay, so the patient is alert and oriented to person, place, time, and situation. Speech is clear. As part of the general survey, he appears well nourished, calm, good hygiene, upright position. His facial features and his body type align with that of a 30-year-old male. So now I'm going to go into the head and face assessment. Upon the first inspection of his head and face, it appears symmetrical. His features are symmetrical. There's no noticeable lesions or masses or anything like that. His hair pattern is coarse with locks. I'm not seeing any dandruff, and I'm going to go ahead and palpate his scalp for any abnormalities. So when I palpate, I'm not feeling any masses, any lesions or tenderness. So now I'm going to go to his temporal arteries and palpate those. All right. And then the TMJ, I'm feeling that. Can you open and close your mouth? Okay, so no crepitus felt there. And then I'm going to check your cranial nerve. Close your eyes. Do you feel that?
Yes.
Do you feel that?
Yes.
Let's try again. Do you feel that?
Yes.
Okay, his cranial nerve 5 is intact. Can you smile big for me? And then frown. Okay, cranial nerve 7 is intact. The next assessment, part of the assessment I'm going to do is on his ears. We'll start with just looking at them. They appear positioned correctly, symmetrical, no keloids or piercings noticed. The skin around looks fine, no redness or anything like that. I'm going to palpate the auricle and the tragus of both ears. Any pain when I touch there?
No.
Okay, what about here?
No.
Okay, and then I'll do a whisper test, so just cover one ear for me. And tell me what word you hear.
Blueberry.
Okay, now cover the other ear.
Cat.
Okay, so his cranial nerve 8 is intact. Now I'm going to look inside his ears to check his tympanic membrane. Okay. So bilaterally, his tympanic membrane is gray and shiny, which is normal. Okay, so the next thing to do is check his sinuses. So I'm going to just palpate those. Any pain on the frontal sinus here?
No.
Okay. Any pain in the maxillary sinus here?
No.
Okay, so his frontal and maxillary sinuses are clear or non-tender to palpation. Next assessment is going to be on his nose. So for the nose, I see that it is centered. It doesn't appear deformed. No discoloration. I'm going to use my pen light. You can tilt your head back. Okay, so the mucosa is fine. The nostrils look dry. Septum is centered. And I'm going to check the patency. Inhale. Okay. Again. Okay. So right and left narrow patent. And then we're going to check cranial nerve 1. Close your eyes. What do you smell?
Sanitizer.
Okay. Well, cranial nerve 1 is intact. What else? So now I'm going to move on to his eyes. So upon looking at them, his eyes are symmetrical. His eyebrows are also symmetrical. I'm going to check his cranial nerve 3, 4, 6. So if you could just follow my finger. Okay. So cranial nerves 3, 4, 6 are intact. Now for cranial nerves 2, 3, 4, which is the accommodation. You look at my finger, and I'm just going to bring it closer, further away. Okay, good. And then cranial nerve 2, 3, which is the pupil response. I want you to just look past my hand, and I'm going to be shining a light. Okay. pupils are equal round reactive to light and accommodation. They went from 3 millimeters to 2 when the light was shined on them. I'm also going to check corneal light reflex, so just look past me, and his corneal light reflex is intact. I also want to check his visual acuity, so if you could, grab that and read the last line for me.
LTFPH.
Okay, so based on the pocket ceiling chart, his visual acuity is 20/20. Okay, so let's see what else for the eyes. I think that's it. Let me just palpate the eye. Oh, actually, let me palpate the eyebrows. Any pain there?
No.
Okay, I'm gonna check the conjunctiva. Look up. Conjunctiva is pink, sclera is white. And then I'm gonna palpate the lacrimal apparatus. Okay, the puncti is not inflamed or anything like that, so that's all good. So I'm gonna move on to the assessment of his mouth. So his lips are not cracked or not dry, they appear normal, no lesions or anything surrounding them. I'm gonna have him open his mouth. Use a light. Okay, stick your tongue out, and then up, and then side. Okay, good. So cranial nerve 12 is intact. Stick your tongue out, and say ah. Okay, good. Cranial nerve 9 is intact. The stents and Orton ducts are not inflamed. His teeth are all intact, nothing's missing. Gums are pink, mucosa is pink and moist. And what else? I think that's about it that I needed to check. Oh, swallow for me also. Okay, so his cranial nerve 9 and 10 are good also. Okay, so moving on down to the neck, the assessment of the neck. So I'm gonna check the cranial nerve 11. Well, actually, first inspection. His trachea is midline, and we're gonna check your range of motion. So tilt your head that way and that way like this, and then up and down, and then around. Okay, he has full range of motion on his neck. Now I'm going to check his cranial nerve 11. So shrug your shoulders for me. Okay, good. Cranial nerve 11 intact. Now I'm going to check his lymph nodes. So preauricular, postauricular, occipital, superficial cervical, posterior cervical, and shrug, supraclavicular. So upon palpation, I'm not noticing any tenderness or masses, so that is good. Make sure. Okay, so now I'm going to move on to his chest assessment. Looking at his chest, it's shaped normally. His anterior, posterior to transverse diameter is 1 to 2. His respirations appear unlabored. I'm not seeing any intercostal retractions or accessory muscle use. I'm going to go ahead and palpate his, I'm going to palpate for paraspinous tenderness. So any pain when I do this? Okay, so I'm going to also palpate the coastal angle. Any pain there? Okay, and I'm going to also check for CVA tenderness with percussion. Any pain there? Okay, good. So now I'm going to go ahead and percuss his posterior lung fields, the apices, the paraspinous, the scalpel, lateral, and the right middle lobe. So any pain from that?
No.
Okay. So I'm going to go ahead and listen to these lung fields now. Each time I lay this on you, just take a breath. Okay. Good. So no adventitious lung sounds heard in the posterior lung fields. the apices and paraspinous region, I heard bronchiovesicular lung sounds. All other areas were vesicular. So now if you turn around, I'm gonna go ahead and auscultate his infraclavicular and mid anterior chest regions. Right. Okay, so once again, no adventitious lung sounds heard on his anterior chest. The intraclavicular regions, I heard bronchiovesicular sounds, and then the mid chest was vesicular. Okay. So now we're gonna go on into the cardiac assessment. So I'm gonna have you lay down. Okay, so I'm gonna go ahead and first inspect for any bounding heaves or lifts in his precordium area and check his PMI, his pulse point of maximum impulse, and I'm gonna check for JVD dissection. So turn your head that way. Okay, no bounding heaves or lifts, and JVD dissension's not present, so that's good. So now I'm gonna just point out his cardiac landmarks. The aortic landmark is the second intercostal space, the right sternal border, and then the pulmonic landmark is the second intercostal space, left sternal border, and then the Erb's point is the third intercostal space, left sternal border, and then the tricuspid landmark is the epigastric region, and then the mitral landmark is the fifth intercostal space, mid-clavicular region. So I'm gonna go ahead and listen to these areas with the diaphragm, and then I'm going to flip it over and listen to it with the bell. Okay, now I'm flipping it. Okay, so no murmurs, rubs, gallops, or clicks are heard. I'm going to go ahead and listen to his, I'm going to palpate first his carotid arteries and then going to listen. Okay, carotid arteries are felt. I'm going to go ahead and listen for any bruise. Okay, no bruise noted. So now I'm going to go ahead and go into his vascular assessment. We'll start with his feet, checking his pulses. Well, actually, lower extremities. They appear non-edematous, no varicosities found. He has even hair distribution. The skin is warm and dry. So now I'm going to check the dorsalis pedis pulse, and those are present. The posterior tibialis pulse is felt also. And then the popliteal, that is felt bilaterally, and then the femoral pulse is felt bilaterally as well. Now I'm going to check the radial pulses. Those are felt bilaterally, and brachial, that is felt bilaterally as well. So now I'm going to check capillary refill on his toes. Okay, cap refill is less than 3 seconds on the lower extremities, and now for the fingers, his cap refill is less than 3 for those as well. His upper extremities show no signs of edema, no discoloration either, and they are also warm and dry. So now I'm going to go into his assessment of his abdomen. So looking at his abdomen, the contour, it's not rounded, it's not distended, the color is appropriate, there's no rashes or lesions. And then I'm going to go ahead and auscultate his for his vowel sounds. Okay, vowel sounds are all heard in all 4 quadrants. And then I'm going to go ahead and check for an aortic pulsations. I'm going to flip this over. Check for aortic bruit. I'm sorry. The aortic pulsations were not seen. Okay, and then I'm going to go ahead and percuss his what's it called? His abdomen. Any pain there? Okay, so percussion's good. I'm going to go ahead and do light palpation for any superficial findings. Any pain? Okay, and I'm going to do deep palpation for any organomegaly. Any pain there? Okay, so non-tender to palpation. Now we're going to go on into his musculoskeletal assessment, starting with his ankles. I'm going to push resistance. Can you push against? Good. Push against. Good. Can you feel me touching your feet?
Yes.
Okay, good. And now we're going to check for your knees. So I want you to kick up, against me. Good. And then let's do the same thing up here. Kick up. Good. No crepitus felt, and he's strong to resistance. What else? We're gonna check like his hips and stuff with him standing. So go ahead and stand up for me. Okay. So I just want you to bend like this. Okay. Any pain there? What about when you do this? Nothing. Okay. Now knees, squat. Anything with that? Okay, so he has good range of motion so far in his lower joints, the ankles, knees, hips. Now we're gonna go for his fingers. I'm just gonna check them. Any pain, anything like that? Okay, let's see this. No crepitus felt. Any pain when I did that? No crepitus in his wrists or fingers. And then we're gonna check the elbows. So put your arms like this. Push against me. Okay. Up against me. Good. He has good resistance. No crepitus felt in the elbow. Okay, good. And nothing, no crepitus felt in the shoulder either. Can you go ahead and do this? Okay. Then try to put your hands down. Good. Up. Good. And then we did this. Okay, so do this, do back. Okay, good. Okay, so he has full range of motion of his shoulders. Do this for your spine. Okay, any pain? Okay, good. So spine is good also. I need to check for paraspinal tenderness. I think I did that earlier. So any pain when I do that? Okay, good. All right, turn back around for me. And next thing is neurological. So I want you to just keep your eyes closed. Okay, he's passed his Romberg test. Can you put your hand out and keep your eyes closed? Flip it. Okay, what is this?
Key.
Okay, what is this?
Colon.
Okay, so stereognosis is good. And then you can open your eyes now. And I want you, I'm going to say 3 words. Chip, white, read. And what do you do at a stop sign?
Stop.
Okay, what do you do before crossing the street? What were those 3 words?
Chip, light, cat.
Okay. So he got 2 of the 3 right. Let's do it again. Book, light, read. Can you count backwards from 100 by 5s?
100, 95, 90, 85.
Okay, good. What were those 3 words?
Chip, light, read.
Okay, great. Alright, so his cognition is coherent and his thought process is intact. What else did I miss? I think that's everything, so this concludes our assessment. Thank you.